Welcome to the 2023 NCLEX Health Promotion and Maintenance Practice Test. This test will have 40 questions with explained answers that will help you prepare for the test. Be sure to resuscitate the like button by turning it white.
Question 1. You're educating a 16-year-old female on oral birth control pills before she leaves the OBGYN's office. Which of the following statements by the patient assures you that the patient understands the teaching? A. If I have sex in the next week, I should have my partner wear a condom. B. If I miss more than 2 days of my birth control, I can just start where I left off. C. If my breasts begin to hurt, I need to take a pregnancy test right away. D. There is no extra risk for me even though I smoke cigarettes daily. The correct answer is A. If I have sex in the next week, I should have my partner wear a condom. When beginning new birth control, a patient should use a secondary form of protection like a condom for the first week. It is normal for breast tissue to become tender and swollen with birth control pills. It is also contraindicated for a woman who smokes cigarettes to take an oral form of birth control due to the high risk for DVT blood clots. Question 2. A mother of a 5-month-old infant tells you that her baby is not sitting without support. She states, "My friend's baby is sitting without support and I am worried that my baby is behind." What is your best response to this mother? A. It's okay. I will ask the doctor for a developmental referral. B. Most infants do not sit up unassisted until at least 6 months. They can sometimes take a little longer as well. C. No need to worry. My baby sat up unassisted at 6.5 months old. D. I don't think it's necessary, but I can ask the doctor for a developmental referral. The correct answer is B. Most infants do not sit up unassisted until at least 6 months. They can sometimes take a little longer as well. Infants usually do not start sitting up unassisted until 6 months and sometimes beyond. There is no need for a developmental referral in this case. It is necessary for the nurse to encourage the mother that the infant is not behind developmentally. Question 3. You're educating a patient on his risks for CAD, coronary artery disease. Which of the following is not considered a modifiable risk factor for this patient? A. Sedentary lifestyle. B. High-sodium diet. C. Smoking for 35 years. D. Family history of CAD. The correct answer is D. Family history of CAD. A modifiable risk factor is something that can be modified by the patient. A family history of CAD is out of the control of the patient. All other options may be changed by the patient. Question 4. Which of the following is not considered a primary preventative measure? A. Vaccinations. B. Use of birth control. C. Hand hygiene. D. Daily regimen of low-dose aspirin to prevent heart attack in a patient with a history of MI. The correct answer is D. Daily regimen of low-dose aspirin to prevent heart attack in a patient with a history of MI. Prior to a condition developing, primary prevention seeks to stop it. In order to achieve this, exposures to dangers that might cause illness or injury must be avoided, hazardous or unhealthy behaviors must be changed, and should an exposure occur, disease or injury resistance must be increased. Question 5. You're assessing an infant who is 6 months old. You ask the mother which foods have been introduced to the infant. Which of the following would require education from the nurse? A. Eggs. B. Honey. C. Squash. D. Mashed potatoes. The correct answer is B. Honey. Honey is contraindicated in infants less than 1 year of age as it may cause botulism. All other foods here are okay to introduce one at a time to a 6-month-old. Question 6. You're assessing a preteen with the father present. The father explains that he is concerned that his child is experiencing depression. Which of the following is not an indicator that the patient is experiencing depression? A. Crying when her friend passed in a MVA. B. Loss of appetite. C. Lower grades when she is usually an honor roll student. D. Insomnia. The correct answer is A. Crying when her friend passed in a MVA. It is normal for people to cry during the grieving process. Crying in the event of a death does not constitute depression. However, the other 3 options here are symptoms of possible depression. Question 7. You're assessing a newborn and you begin asking the mom if she wants immunizations for her infant. The mom says no. What is your best response to the mother? A. Okay then. Here are the informative pamphlets in case you change your mind. B. As you wish. C. I respect that decision. If you would like informative pamphlets, I can get them for you. If not, that is okay too. D. I respect that, but you should know that there is a very high risk for these diseases that could be prevented in your child. The correct answer is C. I respect that decision. If you would like informative pamphlets, I can get them for you. If not, that is okay too. As nurses, we cannot force any intervention on a patient or parent. Answer C acknowledges that you respect the mother's decision to not immunize her child, but also provides information to the mother without being pushy. Question 8. You're assessing a 3-day-old newborn at his first doctor's appointment. The infant was born at 8 pounds 5 ounces. Which of the following would warrant concern for this infant? A. Weight of 8 pounds 2 ounces. B. Weight of 7 pounds 7.7 ounces. C. Weight of 7 pounds 6 ounces. D. Weight of 8 pounds 13 ounces. The correct answer is C. Weight of 7 pounds 6 ounces. It is normal for newborns to lose up to 10% of their birth weight. However, by 1 week old, the newborn should be back up to his birth weight. Option C is a weight loss of more than 10% of the infant's birth weight. Question 9. You're caring for a patient who was recently diagnosed with glaucoma. You know that which of the following ethnicities is at highest risk for glaucoma? A. African American. B. Mexican American. C. Caucasian. D. Chinese. The correct answer is A. African American. African Americans are at the highest risk for glaucoma. Studies show that AA persons have thinner corneas than their European counterparts. Question 10. You're assessing a 2-week-old breastfed infant. Which of the following would cause concern? A. Mom states that the infant is having 2 to 3 wet diapers daily. B. The infant is eating 8 to 12 times a day. C. The mother states that she usually lets the infant empty one breast before switching to the other breast. D. The mom states that it no longer hurts when the infant is nursing. The correct answer is A. Mom states that the infant is having 2 to 3 wet diapers daily. An infant should have 5 to 6 wet diapers daily. Breastfed infants eat 8 to 12 times daily, usually more than formula-fed babies, as breast milk is digested more quickly than formula. If the infant is latched on and suckling properly, the mother's nipple should not hurt. The mother should also let the infant empty one breast before offering the second breast, as the infant needs the hind milk. Question 11. You're educating a patient on why PAP smears are so important for sexually active women. What response by the patient lets you know that the patient understands the education provided? A. I cannot get HPV if I am on birth control. Therefore, it is not necessary for me to have routine PAP smears. B. I would know if I have HPV. My boyfriend doesn't have any symptoms. C. HPV can cause cervical cancer later in life, so I should have routine Pap smears to prevent cancer. D. I am a gay woman. I do not need to have routine Pap smears because my risk for HPV is extremely low. The correct answer is C. HPV can cause cervical cancer later in life, so I should have routine Pap smears to prevent cancer. HPV is a sexually transmitted infection that can live dormant in individuals for years. Most people never have symptoms or test positive for HPV. It is a silent infection. HPV leads to cervical cancer. This is why it is so important for women to receive a routine PAP smear. Birth control does not present HPV. Many men carry HPV and never know that they have it because there are no symptoms of HPV. Lesbian women still need routine PAP smears regardless of the gender of their sexual partners. Question 12. You're assessing a 6-month-old infant at a well-child checkup. The mother states, all of a sudden she is scared of other people. She used to go to anyone. What is your best response to the mother? A. It is normal for infants to begin to feel stranger danger around 6 months of age. She may not be as comfortable with someone she doesn't know holding her now. B. Oh, it's just stranger danger. It'll pass as she gets older. C. This is normal. It is a phase that she will grow out of. D. If you want, I can ask the doctor for a referral to a psychiatrist. She may have anxiety. The correct answer is A. It is normal for infants to begin to feel stranger danger around 6 months of age. She may not be as comfortable with someone she doesn't know holding her now. It is normal for infants between 6 18 months of age to have stranger anxiety. We usually call this stranger danger. It is necessary for the nurse to assure them that this behavior by her child is normal and may even suggest ways to help lower the infant's anxiety. Question 13. The nurse is providing education to an 89-year-old patient about his new blood pressure medication. Which of the following will aid the patient best in understanding? A. The nurse should speak loudly and slowly. B. The nurse should allow time for the patient to understand each subject. C. The nurse should look the patient directly in the eye while instructing so the patient can hear better. D. The nurse should make the patient follow along on a teaching chart. The correct answer is B. The nurse should allow time for the patient to understand each subject. Just because a patient is an older adult does not mean that they are hard of hearing. It is considered rude to speak loudly and slowly to a patient if they do not need this accommodation. The best option here is to allow time between subjects to ensure that the patient understands the education provided. This is true of any age patient. Question 14. You're assessing a 3-week-old infant at a well-child checkup. The mother tells you that she is worried because her infant's breathing is irregular. What is the most helpful response to the mother? A. Oh, that's normal in infants. B. It is normal for infants to have irregular breathing patterns. I will assess her breathing. C. That's nothing to worry about, but I'll let the doctor know. D. This is normal in infants her age. The correct answer is B. It is normal for infants to have irregular breathing patterns. I will assess her breathing. It is important to not put off a parent's concerns about their child. Option B provides facts but also lets the parent know that you will assess to ensure that everything is normal. Question 15. A nurse is working in an OB/GYN office and is caring for a client who had a positive pregnancy test. The first day of her last menstrual period was January 15th. What is her due date according to her LMP? A. October 22nd. B. November 22nd. C. October 8th. D. November 8th. The correct answer is A. October 22nd. Gestational age begins on the date of the first day of your last period. Next, count back 3 months from the month of your last period. Next, add 1 year and 7 days to that date. Here, the LMP is January 15th. January minus 3 months is October. Add 1 year and 7 days and the patient's due date is October 22nd. This is Nagel's rule. Question 16. You're the nurse caring for a mother who has hemorrhaged during the delivery of her baby. Her blood type is AB positive. Which of the following blood types cannot be given to the mother? A negative. B negative. C, B positive. D, AB positive can receive any blood type. The correct answer is D. AB positive can receive any blood type. AB positive can receive any blood type. However, AB positive can only be donated to AB positive recipients. Question 17. You're educating a pre-diabetic patient on his HbA1c. Which of the following is a healthy HbA1c for the patient to have? A, 6.4%, B, 5.6%, C, below 7.5%, D, below 7.0%. The correct answer is B, 5.6%. A1C levels between 5.7% and 6.4% suggest prediabetes. 5.7% to 6.5% imply diabetes, while 6.5% or more implies hyperglycemia. The higher your A1C, the greater your chance of acquiring type 2 diabetes within the 5.7% to 6.4% prediabetes range. Question 18. You're assessing a newly pregnant woman who has a history of 2 miscarriages. She has 1 living child which she carried to 37 weeks 6 days. She has had no preterm births. How would you write this woman's GT-PAL? A, G4T2P0A2L1, B, G3T0P1A1L1, C, G4T0P1A2L2, D, G3T1P0A2L2. The correct answer is A, G4T2P0A2L1. 1. G equals 4. The patient's combined 2-term birth plus 0 preterm birth plus 2 miscarriages. 2. T equals 2. The patient's 2-term births. 3. P equals 0. The patient's 0 preterm births. 4. A equals 2. The patient's 2 miscarriages. 5. L equals 1. the patient's one living child. Question 19. You're caring for a patient with hypertension and CAD that states that he recently started losing weight as his BMI was 30. He states that he is discouraged because he only lost 7 pounds in the first month. What is your best response to this patient? A. Are you making sure to burn more calories than you consume? B. Maybe try cutting out more carbs for a faster weight loss. C. Losing only 10 pounds of body weight at a time improves your overall health. D. Maybe you should consider a weight loss medication today. The correct answer is C. Losing only 10 pounds of body weight at a time improves your overall health. Options A, B, and D can make the patient feel as though you are putting them off. Informing the patient that losing only 10 pounds at a time improves his overall health can encourage the patient in his weight loss journey. Question 20. You're assessing a 47-year-old male patient who is in the clinic today for his annual checkup. He asks you when you think he should begin getting a prostate exam. He states that he has no family history of prostate cancer, and his previous PSA was 2.0 ng/ml. Which of the following information will you provide to the patient? A. Prostate exams are usually recommended to begin around age 50 unless you have a strong family history of prostate cancer or if your PSA levels climb above 2.5 ng/ml. B. Prostate exams are no longer needed. We can test your PSA levels. C. You will start getting prostate exams yearly after age 50. D. Your last PSA level was 2.0 ng/ml. You don't have to have a prostate exam as long as the PSA level stays under 2.5 ng/ml. The correct answer is A. Prostate exams are usually recommended to begin around age 50 unless you have a strong family history of prostate cancer or if your PSA levels climb above 2.5 ng/ml. Unless the patient has a family history of prostate cancer or his PSA is more than 2.5 ng/ml, prostate examinations are typically started around age 50. Depending on the patient's particular evaluations, different physicians will advise various testing intervals. The patient is not required to get a prostate exam every year. The PSA level may not always indicate prostate problems or their absence. Question 21. You're a nurse working at your local health department. You're seeing a patient that is here to get her annual flu vaccine. She states that she is starting college in the spring and will be living in a dormitory. Which of the following should you educate the patient on? A. COVID-19 vaccination. B. Tdap vaccination. C. Meningococcal vaccination. D. HPV vaccination. The correct answer is C. Meningococcal vaccination. Students starting school to live in tight quarters such as a dormitory should receive the meningococcal vaccination. Children ages 11 to 12 should receive this vaccination as well, with a booster around 16 years of age and before college if they plan to attend. Question 22. Which of the following puts the patient at the highest risk for early death? A. Cigarette smoking. B. Obesity. C. Hypertension. D. Coronary artery disease. The correct answer is A. Cigarette smoking. Cigarette smoking has a major effect on a person's health. Cigarette smoking affects all body systems, including the neurological systems, and has bad effects on the brain. Cigarette smoking puts the patient at the highest risk for early death compared to the other options listed. Question 23. You're reviewing labs on a patient with complaints of flank pain. Which of the following labs will you report immediately to the MD? A. BUN 31 mg/dl. B. Creatinine 1.2 mg/dl. C. Urine WBC 6 WBCs HPF. D. Positive pregnancy test. The correct answer is D. Positive pregnancy test. While the above lab results are abnormal, the most pressing is a positive pregnancy test for a patient with flank pain. Flank pain often means kidney infection. A pregnant woman with a kidney infection is at a high risk for fetal compromise. Question 24. You're caring for a mother in the postpartum period, and you ask her if she would like her infant to have the vitamin K shot. Which of the following is most important when educating the mother? A. The vitamin K injection keeps the infant from having excessive bleeding. B. The vitamin K injection keeps the infant from having blood clots. C. The vitamin K injection may leave a scar on the infant's leg. D. Infants are born with adequate amounts of vitamin K, but having more means they for sure will not have bleeding issues that lead to brain damage. The correct answer is A. The vitamin K injection keeps the infant from having excessive bleeding. Vitamin K, when given at birth, keeps the infant from having excessive bleeding. Infants cannot make vitamin K naturally, therefore they require an injection at birth. Excessive bleeding can lead to brain damage and other deadly issues in the infant. Question 25. You're a nurse working in your local health department, and your 16-year-old patient and his boyfriend have come to the clinic together. They both want to have STD testing performed. They state that they are considering having sexual intercourse. Which of the following is true and important education to provide to the patient and his partner? A. Since you are both males and cannot get pregnant, there is no need to use condoms. B. It is important for you to use protection such as condoms to prevent STDs, although you are a gay couple. C. There is no need to have STD testing today since you both have not had intercourse with one another. D. It is not important for you to have routine STD testing if you two are exclusive in your relationship. The correct answer is B. It is important for you to use protection such as condoms to prevent STDs, although you are a gay couple. No matter what a person's sexuality is, protection should always be used when having sex. Gay men are more prone to HIV due to rectal penetration than heterosexual sex partners. Therefore, option B is true. Question 26. A mother of a newborn calls the clinic and reports that she noticed a small amount of blood in her infant daughter's diaper. She said, "It's almost like a period." What is the best response to the mother? A. Please bring her in right away for testing. B. Your baby may just need another dose of vitamin K to stop the bleeding. C. This is normal for your infant. This is a result of residual estrogen from your body at birth. This should subside soon. D. As long as it is a little bit, it is okay. Call us if it becomes heavier. The correct answer is C. This is normal for your infant. This is a result of residual estrogen from your body at birth. This should subside soon. Due to the high amounts of estrogen that a mother passes to her newborn, the newborn can have physiological effects of estrogen after birth. Newborn girls, as a result of estrogen, may experience swollen breast tissue, a small amount of milk leaking from the nipple, enlarged labia, white discharge from the vagina, and a small amount of bleeding from the vagina. This usually subsides by 2 months of age. Question 27. You're assessing a patient who has come in for her annual checkup. She states that she is excessively down and depressed since her husband died 6 weeks ago with terminal cancer. She says, "Some days I just don't want to live." What is your best response to the patient? A. I know it's hard now. I lost my mom last year. It does get better, I promise. B. Do you have a plan to harm yourself or end your life? C. Do you have any supportive family nearby? D. How about considering therapy or a support group with other widows? The correct answer is B. Do you have a plan to harm yourself or end your life? This patient has stated that she does not want to live some days. It is imperative and legal that the nurse ask the patient if she has a plan to harm herself or end her life. Asking this question can prevent the patient from a suicidal attempt. Options C and D are okay, but are not the most important. Question 28. Your patient was recently diagnosed with diabetes mellitus type 2. She asks you what types of foods she should eat for breakfast. Which of the following breakfasts would be best to suggest to this patient? A. Wheat toast, sugar-free jelly, eggs, and 16 ounces of orange juice. B. Oatmeal with brown sugar and maple syrup, eggs, and chocolate milk. C. Whole wheat pancakes with syrup, eggs, bacon, and coffee. D. Oatmeal with butter and sugar substitute, bacon, eggs, and coffee with Splenda. The correct answer is D. Oatmeal with butter and sugar substitute, bacon, eggs, and coffee with Splenda. Options A, B, and C include too much sugar in the meal. Option D is a healthy mix of protein and carbs. Question 29. You're educating a 29-year-old woman when it is best to perform her monthly self-breast exam, SBE. When is the best time for her to perform this exam? A. On the first day of her period. B. On the last day of her menstrual cycle. C. Between day 5 and 7 of her menstrual cycle. D. At the end of each month. The correct answer is C. between day 5 and 7 of her menstrual cycle. 3 to 5 days after the onset of your menstruation is the ideal time to perform a monthly breast self-exam. Every month, carry it out at the same time. During this phase of your monthly cycle, your breasts are not as sensitive or lumpy. Do your exam on the same day each month if you've experienced menopause. Question 30. You're examining lab results for a patient who came in for diabetes testing. Her fasting glucose was 135. What do you conclude about these lab results? A. She does not have diabetes. B. She is at a low risk for diabetes. C. She needs further testing. D. She needs to be educated on how to properly prepare for the test and have it redone. The correct answer is C. She needs further testing. The patient's fasting glucose should be 99 mg/dl. However, diabetes is not diagnosed off of one lab result alone. She needs further testing. Question 31. You're a home health nurse admitting a patient to home health services. The patient has a stage 4 decubitus that must be dressed daily. His caregiver must know how to dress the wound in between nurse visits. What is the best way to ensure that the caregiver understands how to perform a dressing change? A. Have the caregiver write down all of the steps to the dressing change. B. Have the caregiver perform the dressing change. C. Have the caregiver explain the steps of the dressing change. D. Do the dressing change and have the patient acknowledge that they understand. The correct answer is B. Have the caregiver perform the dressing change. The best way to ensure that the caregiver of the patient knows how to perform the dressing change is to have the caregiver perform the dressing change. During your first visit in the home as the home health nurse is when you can do all of the education regarding dressing changes. During your second visit, it is good to have the caregiver perform the dressing change to ensure that they are able to complete the dressing change in your absence. Question 32. You're educating a patient who just found out that she carries the BRCA2 gene. Which of the following statements by the patient indicates she needs more education? A. I will need a double mastectomy to ensure that I do not get breast cancer. B. I will need to perform more self-breast exams and let my doctor know immediately if something changes. C. I may take many medications to ensure that I do not get breast cancer in my future. D. I may pass this gene on to my son. The correct answer is A. I will need a double mastectomy to ensure that I do not get breast cancer. Patients with the BRCA2 gene do not necessarily need a double mastectomy. However, some patients realize that their chances of getting breast cancer with the BRCA gene are very high, so they chose to receive a double mastectomy as a precautionary measure. Preventative medication can be given to the patients if they so choose. Men are able to get the BRCA gene as well. Question 33. A mother of an 18-month-old has come into the office with her child. She states that she is worried about her child because she can only hold on to furniture and walk but will not let go, and if she does let go, she falls down. What is your best response to this mother? A. Let's talk to the doctor today about a physical therapy referral. B. That's okay. Some children take longer to walk than others. She may just be scared. C. Let's reassess if she is not walking by 2 years old. D. Try encouraging her with treats. I'm sure she will get there soon. The correct answer is A. Let's talk to the doctor today about a physical therapy referral. A child should be able to walk by the age of 18 months. Usually by 9 months of age, a child is cruising and holding onto objects and walking. By 12 months, most babies take their first steps without holding on. However, it takes some babies longer. By 18 months, the child should be evaluated by physical therapy if they are not walking unassisted. Question 34. You're caring for a pregnant mother in the OB/GYN office. You ask her if she would like to get the Tdap vaccine today since she is 27 weeks pregnant. The mom asks, why do I need that vaccine? What is your best response to the mother? A. This vaccine can help protect your baby from getting tetanus during her first year of life. B. Infants are at high risk for pertussis, whooping cough. The vaccine can decrease the chance of pertussis by 78%. C. The doctor recommends the DAP vaccine to all of his patients. D. It's important so that you do not get pertussis while your baby is a newborn. The correct answer is B. Infants are at high risk for pertussis, whooping cough. The vaccine can decrease the chance of pertussis by 78%. Between 27 and 36 weeks of pregnancy, a pregnant woman should be offered a Tdap vaccine for passive immunity for her infant. This vaccine puts the infant at a 78% less chance of getting whooping cough, which can be fatal in infants. Question 35. You're educating a 45-year-old obese male that smokes cigarettes on a daily basis. He has COPD and wants to know how he can improve his quality of life since he has grandchildren now. Which of the following will best improve this patient's quality of life? A. Smoking cessation. B. Decreased BMI. C. Breathing treatments. D. Oxygen. The correct answer is A. Smoking cessation. While options B, C, and D may improve the patient's quality of life, smoking cessation will best improve the patient's quality of life. This patient may not require oxygen. Therefore, oxygen may not improve his quality of life at this point in time. Question 36. You're at a school fair educating students in middle school on ways to stay safe. Which of the following is the most important piece of information for this age group? A. Seatbelt safety in the car. B. Helmet safety on a bike/scooter. C. Safe sex with condoms. D. Drownings prevention. The correct answer is A. Seatbelt safety in the car. In 2019, accidental injuries caused more than 7,000 deaths of kids and teenagers aged 0 to 19. That works up to around 20 fatalities daily. Vehicle collisions, asphyxia, drowning, poisoning, fires, and falls are the top causes of accidental child harm. Injury to children may frequently be avoided. Question 37. A father brought his 18-month-old daughter in for her well-child checkup and vaccinations. Which of the following vaccinations will you anticipate preparing for the child? A. Hep B and DTaP. B. Pneumonia. C. Meningococcal. D. Flu, DAP, HIB. The correct answer is A. Hep B and DTaP. According to the CDC schedule of vaccinations for children, at age 18 months old, the child should receive a Hep B and DTaP vaccination. This can vary from child to child based on if the patient is on a catch-up schedule or not. Things happen and children may skip a vaccination. This can often cause a patient to be on a catch-up schedule. Question 38. You're providing education to a male patient who is 50 years old and is in the clinic today to schedule his first colonoscopy. Upon further investigation, you notice that the patient has a family history of colon cancer. His father actually died of colon cancer 10 years ago. Which of the following statements by the patient indicates the patient understands the education provided? A. I am at a much lower risk of colon cancer because I eat a healthy diet. B. I will only need a colonoscopy every 10 years. C. If my occult stool test is negative today, I do not have to get a colonoscopy. D. I may need more frequent colonoscopies due to my family history. The correct answer is D. I may need more frequent colonoscopies due to my family history. In patients with a higher risk for colon cancer, colonoscopies can start earlier than age 50. These patients may require more frequent colonoscopies as well. Patients are still advised after age 50 to receive a colonoscopy whether or not they have a positive occult stool test. Question 39. A 50-year-old male is in the clinic today for his yearly exam. You ask him if he performs his monthly self-testicular exams. Which of the following statements by the patient indicates the patient understands the reason behind self-testicular exams? A. I have low testosterone. I stopped checking my testicles because I am at a lower risk for cancer now that I have low T. B. I do not have a history of testicular cancer in my family, so I usually just skip those. C. If my testicles are different sizes, I need to report this to my doctor immediately. D. It is important to ensure that there is no change in testicular tissue, and if there is, I should report it immediately. The correct answer is D. It is important to ensure that there is no change in testicular tissue, and if there is, I should report it immediately. Men should perform self-testicular exams just as women perform self-breast exams. Men with low testosterone levels are not at a lower risk of cancer. Even if men do not have a family history of testicular cancer, they should still perform these self-testicular exams. Any change in testicular tissue should be reported to the doctor immediately. Question 40. A patient keeping their HbA1c within a normal range is an example of what type of prevention? A. Primary. B. Secondary. C. Tertiary. D. Disease. The correct answer is C. Tertiary. This third method of prevention, tertiary prevention, tries to assist a patient in managing and reducing long-term symptoms of an existing problem rather than preventing a disease or catching it early. It not only aids in restoring one's quality of life, but also stops the symptoms from worsening to the point where they become incapacitating or fatal. For instance, a patient keeping their HbA1c within normal range.
Thank you for watching this video. We hope you enjoyed it. Click the first link in the description to take the free NCLEX practice test. Also, check out these videos that can help you with your future studies. Don't forget to resuscitate the like button and subscribe to our channel, and please share this video with your fellow nursing friends.